welcome back to Simply Women's Health with CJ. Today we're going to talk about vaginal discharge. Concerns about vaginal discharge are actually the number one reason that women seek care in the GYN clinic, so it's something that we actually see a lot of. Here's the thing about vaginal discharge. The vast majority of it is perfectly normal. As far as vaginal discharge goes, between the ages of 12 and 52, your ovaries are active. One of the things that your ovaries does is make estrogen. Estrogen helps provide lubrication for your vagina. So yeah, you are going to have a little bit more discharge during your childbearing years. Think about it, women who are menopausal will often complain of vaginal dryness because their estrogen levels are down and they don't have that vaginal lubrication as much as they used to. So the way that vaginal discharge works, right after you have your menstrual cycle, you're going to have some thin, watery, white to clear mucus or discharge that should not have an odor. Right around the 14th day after your menstrual cycle starts, your body will ovulate. When you ovulate, you create a mucousy discharge that is thick and stringy and actually has a name. It's called spin barket. The purpose of the spin barket is to hold on to sperm. Remember, your reproductive system has one job, and that is to produce a baby. So your body makes this spin barket to hold on to sperm to increase your likelihood of conceiving a pregnancy. So yeah, right around the time you ovulate, you can expect to see a change in your vaginal discharge. Within our vaginas, we have bacteria, we have yeast, and we have what are called lactobacilli. The lactobacilli are the good guys that keep everybody in check. And as long as your pH balance maintains a steady state, the lactobacilli just is able to do their job with no problems. It's when your pH balance gets thrown off that the lactobacilli die off, and either yeast or bacteria can now have a breeding ground to grow in. So what are some things that can throw off your pH balance? Medication use, specifically antibiotics. Having sex, the semen actually has a different pH than the vagina, so some women will have some increased discharge after they have intercourse. If you have perfumed soaps, detergents, fabric softeners, if you are pregnant, again, the hormonal changes in pregnancy can increase it can cause a change in your vaginal discharge. If you are using an intrauterine device, remember one of the purposes of the IUD strings, they change the pH of the cervical mucus, making them hostile to sperm. So some women will have complications, vaginitis symptoms associated with IUD use. When do you seek medical attention? If your discharge becomes white, clumpy, looks like cottage cheese, your vagina itches really, really, really bad, you have pain with urination, your discharge has a foul or a fishy type odor, if your discharge is green in color, if you are having pain with intercourse and pain with urination, again, those are all symptoms that you would want to make an appointment to be seen. So you show up at your gynecologist or your primary care office, and they are, first things first, they're going to get a thorough history. What are your symptoms? How long have you been having symptoms? Have you recently changed any of your personal products? Again, soaps, detergents, fabric softeners. Are you having sex with anybody new? Is your partner having sex with anybody new? Those are all things that your provider is going to want to know. After they get their thorough history, they're going to want to do an exam. So again, they're going to insert a speculum into your vagina. They want to take a look at your cervix because some of the discharges can cause some of the abnormal discharges are associated with sexually transmitted infections, so they do want to take a look at your cervix. They're going to want to take a swab and go in, collect that discharge from your vagina. They may even want to do some STD screening as well. They will send the samples off, and then your provider will treat you based on those results. Some providers will provide treatment before you leave the clinic. Again, though, that is very provider dependent. So just whatever your provider recommends is what I recommend as well. So what can you do to prevent a change in your vaginal discharge? What are some things you can do to keep your vagina healthy? First and foremost, leave her alone. Your vagina is essentially a self-cleaning oven. The reason you have discharge is your body is trying to get rid of the dead cells and the extra fluids in your body with vaginal discharge, which leads me to the second thing. Don't ever douche. If you are douching, you are basically taking fluid and pushing that bacteria that's trying to leave back into your vagina, and it can actually get up into your tubes, increasing your risk for infection later on down the road. Try to use pH balanced soaps that are gentle on your skin. If you want to use a harsher soap, a dial, one of those on your body, that's great. But when it comes to your lady parts, I do recommend, if you are sensitive, to use Dove or Ivory, something that is pH balanced. As much as possible, keep her open to air. Again, bacteria and yeast love a warm, damp environment, and so if you are wearing underpants, it traps that bacteria in there. The last thing that I recommend to my patients, if you feel like you are getting symptomatic, take a nice warm bath, put a quarter of a cup of baking soda in the bath, and just soak for about 20 minutes. The baking soda will help reestablish the normal pH of the vagina. If you would like further information regarding each of the individual diagnoses, please feel free to check out my upcoming videos that I will be posting very soon. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.